Hello students, today we'll talk about how to assess any hilum on a given chest radiograph. First of all, we'll talk about hilum. Hilum is the area on medial most aspect of the lung through which all of the vessels bronchi and lymphatics enter in the lung. Now we'll see how a hilum appears. Hilum, as we can see, hilum is constituted constituents of hilum are number 1 vessels, bronchi and lymphatics. These are the constituents of the hilum. Mainly it is formed by vessels, that is to approximately 95% of hilum is constituted by vessels, and that too by pulmonary arteries, more common than pulmonary veins. As we know that pulmonary arteries, they carry blood, so this will come under soft tissue, will attenuate the X-ray beam, and hence will appear gray. What it means, it will fall on opaque side of the spectrum. So this is the hilum here, this is the hilum here, this is the hilum here. We have different methods of assessing the hilum. We have talked about the area, हम किसको हाइलम बोलते हैं, हाइलम के कॉन्स्टिट्यूएंट्स क्या क्या हैं, हाइलम कैसा दिखता है. नाउ विल असेस. ठीक है. हाइलम, वी कैन असेस द हाइलम बाय लोकेटिंग द horizontal hilar V's. I'll explain this. Horizontal hilar V's. For that, we have to understand the anatomy of the hilum. You can see this is the main pulmonary artery. This is the right pulmonary artery. This is the left pulmonary artery. These are the hilums. This is the left atrium here, and these are the this is the pulmonary vein here. This also is the pulmonary vein here. So what we'll do is, first of all, we'll come to this schematic of a hilum. This is the main pulmonary artery. Just give me 1 minute. This is the main pulmonary artery. This is the main pulmonary artery. This is the main pulmonary artery. This is the right pulmonary artery. And this is the left pulmonary artery. This is the right pulmonary artery. We should see the right pulmonary artery and the left pulmonary artery. The course of these arteries is directed medially and inferiorly, and we can assess them like these are approximate of a size of little finger. This is the right pulmonary artery, left pulmonary artery. This is the lower lobe pulmonary artery of right side, and this one here is of left side. This one is seen in almost 90% of X-rays, whereas left lower lobe pulmonary artery is visualized on 67% of normal X-rays. Now we'll come to the part how we'll assess. So as we can see here, this is the left lower lobe pulmonary artery. Sorry, this is the right lower lobe pulmonary artery. And this is the left lower lobe pulmonary artery. We'll see what? We'll see the other vessel, which would be coming to the left atrium and crossing this hole. This hole is the left pulmonary artery here. This is this. We'll see the other vessel, usually a upper lobe vein. The point where this upper lobe vein will course through the lateral margin of this lower lobe pulmonary artery. This is the point of the hilar V. This is the point of hilar V. And we'll mark this point on both the sides, and then we'll assess the hilum. How we'll assess the hilum? This is the marking we have done, and now we'll come to the point how we can assess the hilum. Assessment of hilum. How will assess the hilum? We'll assess it by, first of all, size of the hilum, then shape of the hilum, then position of the hilum, and then density of the hilum. I'll come to each point one by one. By size, what do I mean by size? We should look for any enlargement here, any prominence here. We'll come to the point where we can see unusual prominence or spurious prominence or apparent prominence, which is not seen in real, not present. It would be found in rotated X-rays. This is the reason why this unusual prominence of hilum is seen in rotated X-rays. Hence, we should always look for any rotation before commenting on hilum. This was the main point which I wanted to highlight here. Next, we'll come to the shape. We should look for any lumpy, bumpy contour. It will denote what? It will denote lymph nodes, lymph nodal enlargement. Third, we should see the position. How we'll see the position of the hilum? We will compare the horizontal hilar V's. For example, we'll mark in this X-ray. This is the lower lobe. This is the lower lobe pulmonary artery here, which is directed inferiorly and medially on right side. This is the left lower lobe pulmonary artery seen on the left. Now we'll mark the upper lobe vessel. This is the upper lobe vein here and this is the upper lobe vein here. Then this is the V point here and this is the V point here. As we can see, this hilar V point, left side of hilar V point, is located superiorly. Left hilar V point should be seen superiorly. In majority cases, or in 5% of cases, it could be at same level. But never ever lower than right. Never ever lower than right. Why? Because first of all, we'll talk about the reason why this left hilum is superior. Because as we have understood, the hilum is constituted mainly by pulmonary artery. We'll see the left pulmonary artery here. The left pulmonary artery is coursing above the left bronchus, whereas the right pulmonary artery is coursing in front of the left right bronchus. That is why left pulmonary artery have to go upwards in order to hook around the left bronchus, whereas right pulmonary artery is coming directly anterior over the right bronchus. That is the reason why left hilum is always superior than right. Now we'll see if it becomes inferior. In cases of pathology, if it becomes inferior, then we should always look for pathology. That too, it will indicate collapse of either right upper lobe or left lower lobe. We'll come to this point. If hilum has a propensity to migrate, whenever the lung is collapsed, attract it will get that hilum along with it. So we'll see this x-ray. This is the left hilar V point and this is the right hilar V point. Right side hilar V point is superior here. This is abnormal. And we could also see the opacity overlying this right upper chest. This is a x-ray showing right upper lobe collapse. One was right upper lobe collapse. Then we'll come to the next. What this collapse will do na, this collapse will pull the hilum towards itself. अगर राइट अपर लोब का कोलैप्स होगा तो हाइलम उसके साथ ऊपर जाएगा. Like in this case, this is the left side hilar V point, but on left we are not able to see any right lower lobe pulmonary artery here. The reason for this is the left lower lobe pulmonary artery, which should have been seen here, has migrated into this collapsed lung. This is the collapsed lung. Right lower lobe collapse. The artery has migrated within this collapsed tissue and therefore we are not able to see this. Now This is the last X-ray. Actually, this was the fourth point of assessing the X-ray. First was of assessing the hilum. First was the size, second was the shape, third was the position. These were the points to assess hilum. And fourth was density. We should always and always compare the density of both hilum. It should be approximately equal on each side. If this is not the case, this will indicate either a hilar mass or a lesion. Whenever the size is enlarged, whenever the hilar size is enlarged, we should look for the shape. If it is lumpy bumpy, it will indicate the lymph nodal enlargement. If the shape is preserved, if the shape is maintained, no lumpy bumpy contour is seen, and the vessels are enlarged, then this will indicate pulmonary artery hypertension. This is the X-ray. As we can see, this is the left lower lobe. This is the right lower lobe pulmonary artery. This is the upper lobe pulmonary vessel. This is the left lower lobe pulmonary artery. And this is the upper lobe vessel. We can see the position of hilar V point is maintained here. Left one is higher, good enough. But the size of the hilum is enlarged. Next we come to the contour. There is no lumpy bumpy contour. Instead of this, these lower lobe pulmonary arteries, they are enlarged in size, and this enlargement is usually more central. As we come to the peripheral two-third, these vessels are disproportionately smaller. These peripheral vessels are disproportionately smaller. Peripheral vessels, leading to the popular morphology of jug handle. And this is usually seen in pulmonary arterial hypertension. This was all about how we can assess the hilum on a given chest X-ray. Thanks for patiently listening.